All right, good morning. This is Senate Health and Welfare, and it is February 23rd. This morning, we're taking up a couple of bills and then some testimony on an issue. So we're starting out with S-187, which is related to the application of sunscreen. We've been through the bill. And now we're continuing testimony this morning from the Vermont school nurses and others. And just FYI for committee, there's also some testimony posted on our webpage from Dartmouth Hitchcock, and I think there'll be additional testimony from some of the medical providers regarding that bill. We are welcoming Clayton Wetzel, who is the treasurer of the Vermont School Nurses Association. Thank you for being here. And so you can unmute yourself and then you did. Appreciate it. And so welcome. Why don't you introduce yourself for the record and then we'll listen to your testimony.
Thank you very much. So my name is Clayton Wetzel, and I'm the full-time school nurse at Waitsfield Elementary School and the current treasurer and executive committee member for the Vermont State School Nurses Association. Thank you so much for affording the time for the Vermont State School Nurses Association to share their thoughts on this bill. It is so important for those on the front lines of care for Vermont's children in schools to weigh in on how the legislation will affect care. As you know, skincare is something we can work to prevent with simple sunscreen and sun exposure awareness. The American Society for Dermatologic Surgery Association created the Sunucate Coalition, which is comprised of 59 medical specialty associations, patient advocacy groups, and other organizations, and uses its collective voice to protect students from dangerous ultraviolet exposure while outdoors at school. The VSSNA reviewed the Sunucate model legislation along with existing state education and submitted recommended language to the Vermont Secretary of Education, at that time was Dr. French, on March 9th of 2023. Currently, 27 states and the District of Columbia have passed similar legislation. Along with Vermont, 2 additional states, Massachusetts and New Jersey, have proposed language submitted for legislative review this year. We are very appreciative that S-187 contains all of our recommended language in the current sunscreen legislation. We are pleased that the Vermont Department of Health was proactive and did reach out to our organization for input into the bill before you. The language in the bill works nicely and will allow us to continue our high standards of care regarding medication administration in schools. S-187 works to create a consistent state policy that ensures children have access to FDA-approved sunscreen at school for over-the-counter use, and it does not require the school to provide sunscreen or have school personnel apply the sunscreen. Passage of S-187 will provide protection to more than 80,000 Vermont children from damaging UV exposure. In my time here with you, I'm happy to take any questions regarding medication in schools or any other questions about the specialty of school nursing and how we advocate for children's health and safety. Additionally, please note that the VSSNA supports the use of child restraint systems in motor vehicles and the public outreach campaign, but does not have any additional comments for testimony of Section 1258 child restraint systems within this bill, although I believe that that actually has been removed now. In summary, we are grateful to representatives for considering the health and safety of our students in schools. We appreciate your time to share the school nurse perspective as you consider revisions to S-187. That was my original, and then I did submit an addendum as just clarification on over-the-counter medications for how we do that in schools. And I didn't know if you, I submitted that late, so I didn't create that.
We have it. You know, it's on our webpage. Thank you. It's great.
And so I can read through the addendum if you'd like, or if it generates questions, I can take questions. I'm not sure which way you'd like me to go with that.
Well, why don't you just go through it briefly with us? But okay. Some folks are not looking at their screens.
Okay. So one of the things I mentioned in my original testimony was about over-the-counter medications and how we do them in schools. And this was just more of an explanation of what our current practice is and how S-187 can impact that practice in a positive way. So current best practice recommends the following guidelines for all over-the-counter medications that are administered in schools. So annual written parent permission, medications delivered by the parent or guardian in the original store label bottle or container. We have to store it properly. We administer that medication as it's required. And every time we give medication, it must be documented in the student health record with the day and time the medicine was administered, the dose given, the reason for the medication, and the outcome or results of the medication. And finally, written or verbal parent or guardian notification each time an over-the-counter medication is administered. And sunscreen falls into the category over-the-counter because of the active ingredients within the sunscreens. So FDA defines over-the-counter drugs as drugs that do not require a doctor's prescription. It's bought off the shelf in stores. It's regulated by the FDA through the OTC drug monographs. And OTC drug monographs are kind of a recipe book covering acceptable ingredients, doses, formulations, and labeling. And I provided some examples. So Aquaphor or Vaseline is an OTC medication because it has petrolatum in it. Neosporin, which is a lot of people put on their wounds, bacitracin and polymyxin B are in that. Caladril Clear, which is a clear calamine lotion, that has proxamine hydrochloride and zinc acetate, and even cough drops like Ricola has menthol 1.1, so is also considered an over-the-counter medication. So all of those are in our offices, and we have parent permission, and then we can use those in our offices. So if enacted, S187 would eliminate the need for the school nurse to store, apply, and/or the need to notify a parent or guardian of sunscreen application. Many Vermont schools, school districts, and supervisory unions collect student health information annually. This typically includes a section for stock over-the-counter medications such as ibuprofen or Motrin, acetaminophen, Tylenol, diphenhydramine, Benadryl, cetirizine, Zyrtec, and calcium carbonate Tums. Parent or guardian permission for the students to self-carry and apply sunscreen could be added to this section. These documents are reviewed annually by the school nurse, so the OTC permissions is included in the individual student health record, either electronic or a hard written copy of that. Enacting S187 would provide students with increased protection to sun exposure as it removes the barrier for them to bring, possess, and apply sunscreen without restriction, as long as they have parent or guardian permission. And this process is done in accordance with school nursing best practice. Thank you.
Thank you. That's a great addition for us to about what happens in school. So thank you very much for that. Questions committee. For Clayton. Any questions? Go ahead.
Thank you, Clayton. Question about what happens if a student shows up and they're gonna be outside for whatever and they don't have any sunscreen? Are you gonna have anything on hand for them or?
So that's always a challenge. And so we always have some sunscreen on hand, but if we don't have permission from the parent, we'd have to call the parent and get permission then to apply it. And for like preschool and kindergarten, we'll probably still have some kind of procedure in place that allows us to apply sunscreen if necessary. As the kids get older, that shouldn't be as much of an issue from just having the contact in their skin. But the answer is that right now we do carry sunscreen. It expires annually, so we have to throw whatever's left over away. The idea behind this is if this gets approved, then we can have it on the annual health survey that we get from all the students. The parents will be able to check that off early, and then they can provide it. The challenge with any of these things is, will we have a medication that you need that if it's over the counter, we can't really anticipate what that could be. And so we could have sunscreen in the office, and then we would still have to get permission to apply that either in writing or verbally if that was to occur. And what we're hoping is this, if there's an education piece of this too, then parents would know that the child can have that. Some of them don't send it because they're not allowed to right now, and it's too hard to keep in the office. So this might alleviate that barrier, allowing those children to actually carry it with them.
Thank you.
Thank you. That's helpful. We did have questions the other day about the younger kids, the kindergartners and so on, that and how they would deal with it. So this is helpful.
Thanks. Clayton, thanks for your testimony and for all you do as a school nurse. You guys are so important to our schools. And what Senator Lyons just mentioned, the younger kids, and you mentioned also the preschoolers and the kindergartners in particular. If this were to pass, it says that they don't need, would teachers still help them apply it if they need help? I'm a mom of 3 kids, and I just know that preschoolers and kindergartners and even some first and second graders might have a hard time applying it themselves safely. I know it's not required that they get help, but that, I guess, the sort of logistic, I'm also worried about the, like, you know, sunscreen exploding in the kid's backpack kind of situation, but
Oh, yeah.
I've cleaned out a lot of backpacks. But for the little kids, would there still, do you think, I know you can't speak for everybody, but do you think there would still be an opportunity for them to get help?
I do, and I appreciate the question. So with paragraph B, talking about adopting policies that would allow for that, it would be by school, but preschool is actually driven by different requirements than kindergarten through 12th grade. So in preschool, because of their age, we would still get written permission, and that would be also including the fact that we would be applying that. So we can provide sunscreen, and I'm speaking for our district or my school specifically, but we would still provide sunscreen. We try to get something that is as benign as possible because kids can always have skin reactions, and we have to be really careful with that. But when I talked with the nurses across our state, and actually some nurses across the country on this topic, it really is, we look at pre-K, kindergarten, and maybe first grade as being the ones that would probably need the most help just from the standpoint of making sure that they're protected, not getting in their eyes and those types of things. So we would write a local policy that would indicate that the teachers could assist. So some kids in kindergarten and first grade are very capable of doing all those things themselves, but some might need assistance. In those cases, we would be able to help with that. And, and I think that's reasonable. And because paragraph B exists, we would then, all the nurses would look at that and decide what makes the most sense for their school or the school district.
Great, thank you very much.
Okay, any other questions for Clayton? Thank you. This is really helpful. We greatly appreciate it. And thanks for your work in bringing this to us. It sounds like you've been on the front line with this in Vermont. We appreciate it.
Well, thank you. And we really appreciate being included in this. The Vermont State School Nurse Association and the school nurses in general want to be able to share what we do as much as possible when it comes to the health and welfare of our students, their staff. And so we really thank you for this opportunity to be able to testify today.
Yes, terrific. I know, and one of our senators was a school nurse for a period of time, so it's nice to have another connection.
I'd be curious to which one's more fun.
Was it Sarah Cattell or her? Yeah, Senator Cattell.
Okay, that's good to know. Thank you.
Great. All right, so we'll move on to Colin Robinson. Thanks for being here.
Thank you, Senator. For the record, Colin Robinson, Vermont 98. I don't have any prepared remarks because Clayton was wonderful. And I just want to acknowledge, as you already have, the work of our school nurses every day and for a long time, past 4 years in particular. I will say at Vermont NEA, we have taken our guidance in response to the pandemic and other health issues from our members who comprise the School Nurses Association. So quite frankly, I don't have any substantive additions to what Clayton spoke to. And organizationally, Vermont NEA is comfortable with the bill as currently drafted and presented, and recognize that and appreciate the provisions in there that localized policies will be developed to address kind of unique contours in different schools and different communities, as well as also making sure that there's sort of that liability provision that, you know,
Right.
God forbid somebody develops skin cancer at a later age, you know, there's not some cause of action that results from them. So.
Terrific. Thank you. Questions? Great.
Who can oppose applying sunscreen? You know, I mean,
The further upstream you go, the better you get.
right, absolutely.
It's good. All right. Oh, wow. That's great. Thank you.
Okay.
Right, we might get time to go through the bill with Katie briefly after. So we have Brendan Atwood, and just as a comment regarding the original bill that had the car seats attached. The way that bill got drafted was, Senator Renner was interested in car seats, I was interested in car seats. And then I became interested in sunscreen because of Brendan Atwood, who were reaching out. And so we put those two things together and now they're separated because the car seats have gone the way of transportation in the transportation bill. And then this is returned to us. So it's now a separate bill, but I'm very pleased that we're able to look at it in here. So Brendan, thank you for being here and offering some comments on the bill.
Good morning. For the record, Brendan Atwood, Policy Director with the Department of Health. Thank you again for having us back here today. I also don't have a lot more to add, but I'm certainly happy to answer any questions that the committee may have. I think Clayton really outlined the issue very well, and we appreciate the support that he articulated. You know, from our outreach as well, we think that there's pretty broad consensus in support of this bill. And we think that we've been able to address most of the potential concerns with regards to liability and the school policies. I will just note for the committee's discussion, there has been some discussion from stakeholders about the appropriateness of excluding, as the current language does, non-aerosolized sunscreen. After consulting with stakeholders on this, we would actually recommend striking out the word non-aerosolized. That's been suggested to us that could create an equity challenge for some folks. So certainly I would welcome others to comment on that and their sentiments on the appropriateness of that. But I think other than that, happy to answer any questions that you may have.
Okay, yeah, so Senator Hardy has a question about non-aero.
Yeah, I'm curious, I'm just trying to think through what you just said about the equity issue and non-aerosolized. Can you say more about that?
Yeah, and you know, and Elisa, who's also here as well, may be able to say more. But my understanding is that essentially by restricting the use of aerosolized sunscreens, it just may force some folks to have to purchase sunscreens that may cost more. It just limits the options that are available to some folks, which may cost some. I think it's mostly economic concerns. On the flip side, there are concerns about using aerosolized sunscreens in environments where folks may have asthma and it may trigger those symptoms. But I think given the flexibility that this bill allows for in terms of schools determining their own policies, it may be appropriate, for example, to allow aerosolized sunscreen outside the school and restrict for inside the school and non-aerosolized. So Elisa, I don't know if you've got anything to add to that.
Elsa, why don't you introduce yourself in the record and you can shake your head officially.
Happily. Again, it's good to see everyone. I'm Elisa Stolberg. I'm the Director for Family and Child Health at the Health Department. And I officially shake my head. No, nothing additional to add.
Okay, thank you. So, so it's a question of schools being able to develop policies regarding different types of sunscreen, so that.
Yeah, I just would be concerned about aerosolized.
Yeah.
Sunscreens being sprayed inside with, they are pretty
Right.
irritating and automatic.
So then to the point, is the bill allowing the district to make that decision, or is the bill simply restricting aerosol?
It restricts aerosolized, it just says non-aerosolized, so we'll go, I think we'll have time, maybe we can go through the bill again with Katie and then find that language. But the Department of Health is recommending striking that limitation and then allowing for schools to develop policies related to it.
Correct. Yep.
Yeah, okay, all right. Oh, so we'll go through it, we can have that conversation. Well, Lisa, was there anything else that you wanted to add at this point? And it would be helpful, I think. I don't think Clayton is still on Zoom, is he? He is. Oh, good. Clayton, there you are. Why don't we ask you for comments at this point regarding aerosolized and non-aerosolized and what your thoughts are?
So thank you for the opportunity. It's Clayton Wetzel, school nurse, the Vermont State School Nurse Association again. So I had done I looked up aerosolized versus non-aerosolized right before we came on today. It does appear that, and this is just anecdotally, but aerosolized doesn't put as much product out for the period of time that people are applying it. So, and it also uses propellants that could possibly be an irritant. And the other part, speaking about the backpacks again, having a aerosolized product exploding in a backpack would make even bigger mess than just leaking, and could be a little bit dangerous. So I think that the original idea behind having the language was because it would be better for the environment to not do that, for clean air in schools, to not have propellants, although it might be applied outside, but it could be applied inside. So, but I do understand the equity piece. Some families can only afford to buy one sunscreen. If they have aerosolized sunscreen, we've now restricted them to provide that sunscreen to their children when they're at school. So that could be problematic. And we want to just make sure that folks have the right sunscreen at the right SPF. So I think scientifically, the products are out there. And it's really, I guess, a question of how long you have to apply it for it to be effective on the skin. And there is the chemical compounds that are used to expel the product that might become a little bit of a problem also.
Okay, thank you. So I'm gonna go back to Elisa, and I know we'll have questions. So Elisa, you had a further comment relative to what we're hearing?
No, I don't have anything additional to add at this point. We've talked extensively to Clayton and the VSSNA board, and we feel really excited about the possibility of this bill.
Okay, thank you. All right, good. Questions?
Actually, I don't know if anybody has the answer to this, but are non-aerosolized sunscreens cheaper?
I don't know.
I don't understand the equity issue. Like, I feel like.
I think what I'm hearing, and correct me if I'm wrong, Clayton, but or Elisa or Brennan, what I'm hearing is that if someone already has an aerosolized sunscreen and we prohibit it, then they have to go out and buy another one, a different kind. I see you shaking your head. That's the issue. Is that the issue? Now, or if they go out and they buy an aerosolized, bring it to school and then find out that they can't use it. That's the equity issue.
Correct, Madam Chair. Yep.
So, here's what I'm gonna suggest. I'm gonna suggest that we ask our ledge council to come up and then go through the bill, and we can have the discussion about what we might do around that particular section as well as others. Katie, does that work for you?
It does. Didn't know it was coming up, so I'm not logged into Zoom.
Huh?
I didn't know it was coming up, so I'm not logged into Zoom. Let me pull it up.
We're moving along on this, and that's great. Actually, we can move it.
Well, she said we have a process question.
Sure.
Is the reason why we don't vote, like quickly vote on things because they have to be warned? Then gives an additional day or whatever.
No, that's just a personal decision. I always just ask the committee if you'd like to wait a day.
Okay.
And that's, yeah,
I just wondered if it was like a requirement to warn.
not at all. Good morning.
Good morning, Katie McLennan, Legislative Council. So you're looking at S-187.
Can I make a suggestion?
Yes.
That we go through it fairly slowly and that the committee has an opportunity to make comments or suggestions regarding the language.
Great.
I think, unless we're not familiar with the bill, I think that.
So the first half of the bill, as we've already discussed, applies to sunscreen. It's in Title 16, which is our education title. And it's adding one new section about the possession and application of sunscreen. In subsection A, pursuant to the requirements of this section, each public and approved independent school in the state shall permit students with the written authorization of a parent or guardian possess and self-administer a topical non-aerosolized sunscreen while on school property or at a school-sponsored event or activity without being required to provide a medical provider's note or prescription, or having to store the sunscreen at a specific location. A school shall keep on file a parent or guardian's written authorization. And then in subsection B, it allows the school to adopt policies to allow school personnel to assist a student in applying topical non-aerosolized
I
sunscreen.
want to just stop at A briefly and
Sure.
just to, that what we heard previously was that there was a lot of administrative process. If it, without this bill, then the school nurse has to notify the parent when it's applied. So I think I heard reading his testimony. And there's an ongoing process for, well, notifying parents. But in this way, it's just one written or one written permission or authorization, one written authorization, and they can put it onto a single list of all the authorizations. That's what we heard from Clayton.
Is the parent authorization necessary because of some federal legislation or just something that we're
For this?
creating? For sunscreen, for application of
No, this would be,
FDA.
Yeah, that's what Clayton just went over,
That's
saying that it's because of the ingredients in sunscreen, they're regulated by the FDA. and have to have
That's what
parent
we're
permission.
talking about. Okay.
Yeah.
Very good.
okay. Sorry, stop, but I just want, clarity.
Sure.
Yeah, it's good.
Okay, I will move on. So subsection B allows the school to adopt a policy that would allow personnel to assist the student in applying topical non-aerosolized sunscreen if written permission from the student's parent or guardian is obtained.
So this is the place where the non-aerosolized shows up.
It showed up in A too, it shows up throughout it.
Yeah,
Yeah.
so let's go through the bill and then we'll come back to that discussion on aerosolized.
Okay. In C, school personnel are not required to assist students in applying sunscreen and shall not be responsible for ensuring that sunscreen is applied to the student.
But the school could have a policy that says for the little ones, it's okay to help.
Yes, and B, the school could adopt policies, it's optional if they want to adopt a policy that would allow school personnel to assist a student. In subsection D, school and school personnel shall be immune from civil liability for any actions taken in good faith and reliance on the provisions of this section. This section shall not apply to reckless or intentional misconduct on the part of the school or school personnel. And then we have a definition of sunscreen to mean a product regulated by the FDA for over-the-counter use for the purpose of limiting ultraviolet light-induced skin damage. That is it, for one section.
Okay, that's the bill.
You
Because the
will,
restraints are.
yeah, you will need an amendment to just have the sunscreen portion of the bill, so.
So can we strike the child restraints? Is there anyone who would not want to strike section 2? How do we do that?
My understanding, you would probably know better than I would, that your colleagues have
Transportation.
have taken a look at the child restraint systems and they're addressing that issue. I don't know where that.
It's
stands.
already in the transportation,
Okay,
miscellaneous
okay.
transportation.
So because this language, the child restraint system is in the bill is introduced, you still need an amendment, a strike all amendment. That
Okay,
would just have the sunscreen language in it.
let's do it.
Okay.
And then, well, first it's a strike all, but now we we
Mark up.
may possibly amend the language.
Okay.
Okay. Go ahead.
Are we talking about the language now?
We're just getting now, we're gonna talk about the language and let's talk about aerosolized, non-aerosolized.
You want me to say?
Oh, yeah,
Okay,
yeah, we're
I
gonna
will
do markup.
say-
We want to do markup, right?
Okay.
We're on the way.
I'll start putting together the amendment.
So, just doing some quick research on aerosolized.
Good.
I don't really buy the equity issues. I mean, I don't think it's any more expensive to buy so. hold on.
Yeah, okay.
I understand if you already have it, but every new year you kind of have to buy sunscreen, so to have sunscreen, so if parents know they need to buy the
latest.
non-air, they'll get whatever they can afford in that area. And looking at the aerosolized, first of all, a lot of them, not all of them, but a lot of them contain benzene. And benzene is a
Bad.
carcinogen that causes cancer.
Causes bone marrow cancer.
And I think even though we're spending so much time on PFAS and other things in here, we would want to do that. The other thing it does is it contains, what is it? A chemical that is, what is it? That's basically harmful to the environment, both the air pollution, but also the National Park Service has this whole thing about sunscreens that are bad for coral reefs and with people swimming in the
Don't want
oceans.
the Lake Champlain coral reefs.
Well, I mean, obviously this
I
isn't
can't-
relevant
yeah,
necessarily
yeah,
to
yeah.
Vermont, but just that there are ingredients, particularly in spray sunscreens, that are pretty bad for the environment, so I don't.
What's your conclusion, Sam?
I think we should keep the non-aerosolized in there because I don't think there's enough evidence that there's an equity issue to outweigh the health and environmental
Risks and
issues.
benefits. What do we think about that after Senator Hardy's instant research?
Yeah, so it's good research.
Yeah, it was quick, but.
I don't buy the equity issue. I think it's kind of, it's minor, but I do think that, whether parents, I would leave it to the parents to decide aerosol, non-aerosol. I think we're way down in the weeds. I think the intent of the bill is good, but I don't think the aerosol aspect is.
So, let's make sure that our Department of Health is still up there. And I'm trying to sort out the thinking on the equity issue and then weighing the risks and benefits. And we've just heard some of the propellants that are there. Did you go through that type of analysis?
We did, and the language that's in the current bill, again for the record, Brendan Atwood, Department of Health. The language that's in the current bill was proposed by the department, and I will just be candid that there has been some lack of consensus on this specific question, and so we thought it was best to ensure additional flexibility by removing that non-aerosolized language in the bill and allowing schools to make those determinations themselves based on all the considerations that Senator Hardy has raised, as well as any other pertinent ones. So I think in short, we're comfortable with either direction that the committee decides to go on this, but our recommendation would be to remove the non-aerosolized language from the bill.
Okay, thank you. Okay, so it's a policy decision here around the table. So let's go to that section. Where is it first utilized in the?
A, subsection A.
Bill? Let's look at it. We can decide. Oh, yeah. Okay. So it's in A, section 1. Non-aerosolized sunscreen. Wow, as we thought. Yeah, so they're also, I mean, if a kid comes into school with the aerosolized and we say non-aerosolized, then we've heard from the Nurses Association that, at least in some districts, the nurse will have on hand, sunscreen that the child could access. So that speaks for leaving it as is. On the other hand, there might be, I don't know what the reason would be for having to use aerosolized. So committee, just your thoughts. Let's take a straw poll. Let's do, who would like to leave it as it is and who would like to take it out? Who would like to leave it as it is? I can't have both those ways. Who would like to leave it as it is? Rita? Yes or
I
no?
don't care.
Yes, who would like to leave it? Oh, you don't care.
Well, I mean,
Okay,
I think it's not an important point.
it's not an important point. Okay,
I prefer to leave it, but whatever, I'm, leaving it.
okay,
Let's strike it.
you'd strike it.
Let the family decide. It's convenient.
Okay, I'll start it too.
Thanks a lot. You put me in.
Madam Chair, decide.
Yeah. I think I'd strike it and then I might say something about school policies. Or the use of use of aerosolized outside. I'm not happy. I don't like it.
I just think that putting all of this on the schools, like. it's the same
Yeah, I
thing that
agree.
happened for
Let's
four
just-
schools
let's
having
leave
to
it.
decide about math.
Let's leave it,
Let's
and
just
you know
make the
what,
decision here.
if the schools really are disturbed by the fact that that we haven't resolved this and allowed for it, and if the other side of the legislature, the House can look at this as well. Let's leave it as it is, I'll go with the end of the table on this one. We're good. Okay, then let's move on. Is there anything else problematic or that you'd like to consider in the bill? Sorry, guys.
We're used to it. Good custom.
But the benzene is not a good thing. I mean, I use benzene in research early on in my life, and I keep worrying about when my mom getting bone cancer, but you see what happens. All right, marrow, it's hematoma, I think. And, where are we, Katie?
I'm saving your amendment. This is where I am,
Okay,
so that's why I
Take your
have it pulled
time,
up.
take your time. The more we can get done, one swell food will good.
I'll just share the amendment that I just put together.
Yeah, sure. And just as a reminder, we have had other testimonies submitted to us to put on our web page, and I've asked Kiki to put that up.
This is not on the website yet.
No, okay,
I just wrote it.
maybe expand it teens a bit.
Sure.
There you go.
Okay. So we have our lead-in language that we're striking out all after the enacting clause. Starting thereof, the same section 1 that you have just looked at. So the language itself is not changed. You have chosen to keep in topical non-aerosolized sunscreen in 2 places that it appears. And then we've struck out the car restraint system language. The effective date section is now section 2, effective on July 1, 2024. And that after passage, the title is an act related to student application of sunscreen. That's it.
There it is. Is there anything else?
Let's do it. Should we pass it?
My suggestion is that we hold it for a day. This one, we don't hold this one for a day, and we just really have the language, and I know it's probably something that tomorrow morning, I'm not doing this tomorrow morning, but maybe Tuesday, tomorrow, Saturday, maybe Tuesday, we can come back to it if there's time. I know the floor is gonna be pretty big on Tuesday, but the latest we'll do it is Wednesday. How's that? This will be up for vote, and I'll have Kiki put it on for both days. And then. Good, does that suit everybody? Are we okay with this? Awesome. Very awesome. Clayton, thank you. I see you shaking your head also. And Brendan, thank you. So it's on us about the aerosolized and non-aerosolized.
That sounds great. Thank you so much for looking at this and taking it up.
Yeah, no problem. And I know that Commissioner Levine sent me a note regarding kids with lupus and about that. But, you know, one of the things I think about is our kids who are using sunscreen because they may have lupus. Older kids may have lupus. And that's a disease that nobody sees. You know, you get tired or you can't go to school as many days as others. And if you also have to go in and access sunscreen, there might be a stigma associated with it. So it's nice to have it available and let kids, use it regardless of the chronic conditions. Okay, so we're gonna go off live for a short break and we will come back at 10 on the dot for S98.